Good afternoon, everyone. Thank you so much for joining us today and taking some time out of your day to learn about University of Vermont's Integrative Health and Wellness Coaching Program. So we're going to talk for a few minutes here about our agenda. Who is on the call? Going to do some quick introductions. Why Integrative Health? Why Integrative Health and Wellness Coaching at the University of Vermont? What is that program and the logistics? And then have plenty of time for questions and answers today for you as well. As I indicated in the chat, that's where you want to add your questions. And we are recording this session if you need to jump out, or if you want to watch it again later, we will share the recording out with all people who are with us and have RSVP'd. My name is Nicola Willier-Fenton. I work in our Continuing and Distance Education Department, and I'm so happy that we have Susan Whitman here with us. She's a lecturer for the Integrative Health and Wellness Program at the University of Vermont, a curriculum consultant for our program, and a certification mentor for Duke Health Coaching Program, and co-founder of the Community Kitchen in Richmond. Susan, welcome. Thank you so much for being with us today. And we have Cara Feldman-Hunt. She is the visionary behind this program. We're so fortunate that she is the program manager, a certified health and wellness coach, functional medicine certified health coach, and an instructor in our program, and has also been working on a lot of integrative health policy as the Academic Consortium for Integrative Health and Medicine co-chair for the policy committee. Cara, thank you so much for being with us. And good morning, Devin. Thank you for saying hello in the chat. Okay, so we're going to try to get you in and out here in a half hour, but we will have time for questions. Please ask throughout the presentation, but we're going to dive right in. And Cara, why don't you get us started? Give us kind of that overview. Bring us back up to talk about integrative health and wellness before we get down into more details.
Sure. Hi, everybody. So I really like to say that integrative health and medicine is really just good medicine. It is an approach to medicine that really takes into account the whole person. It's a lot about the relationship between the practitioner and the patient, and it's evidence informed and really starts with the least invasive approach first. So in my mind, it should just be the approach that everybody uses, but we still use the word integrative health and medicine. Sometimes it's called whole health or holistic health, but hopefully that frames it for everybody. So, we started this program a while back, and, I really was kind of thinking about it. The university and the College of Nursing and Health Sciences and continuing distance education, we have a bigger job than ever to educate our healthcare providers. Our population is aging. Chronic diseases are way too common right now. And according to the CDC, 6 in 10 adults in the US have a chronic disease. And 90% of our nation's healthcare expenditures pay for these chronic conditions. So we're really pushing this program because health coaching can really help with health promotion and prevention. Just a bit of a history behind our program. The seed was planted in 2015. It took us a while to really launch. We established in the fall of 2019. I joke around with Susan because when I first came up with the idea of developing a health coaching program, Susan was the first person I called and said, hey, what do you think about health coaching? Because she was the only health coach I knew at the time that was really practicing and doing an integrative approach, actually. And so we realized that there was a lack of training programs for undergraduates in our area and actually nationally. And that, Vermont is really moving to this value-based care proposition. Value-based care is different than fee-for-service. So really taking care of our population as a whole, and felt that we really were poised and ready to develop this program. And the big push was this establishment of the National Board for Health and Wellness Coaching, which really took the field to a whole new level. There's now this national certifying board and a national exam. So we're an approved training program, and our students can sit for this national exam.
And many do. Would you say that almost all do?
So our first cohort took the exam. We had a 94% pass rate. We were pretty excited about that. We do include exam prep in our program. And yeah, in our first cohort, I think 18 of our 20 first students took the exam. So that's a pretty good rate.
Yeah, that's a high percentage of people that say this is an important
Yeah.
credential to have. Thank you so much, Karen. I know we're going to hear a lot more from you in a few minutes. So, Susan, you have the most experience with being a health coach per Cara's first phone call. What exactly do health coaches do? And I also, this seems to be getting more and more popular.
No, that's a great question because I came to health coaching after being a physician assistant for 10 years. And I was in there telling my client, if you just exercise more and decrease the stress in your life and eat better, you wouldn't have to be on all these medications. And then I'd say, okay, see you in 6 months. Good luck with that. And people weren't making the changes. It was a really frustrating place for me to be. And I didn't understand, I didn't know how to motivate people or how to get them to try to take these lifestyle changes on. Like that slide was saying, how much of chronic disease is related to our lifestyle. So health coaches are here not to educate, not to tell people what to do, not to give them an exercise plan and a meal plan, but to really help them find their inner motivation and desire for change, and then to help them come up with a plan on how they're going to do it. So I often say, I want my clients to be walking away with a huge amount of motivation to get something done and a plan on how they're going to make that happen. So as a health coach, what we really start with is helping define someone's why. Why do they want to make a change? What is really important to them? We talk a lot about people coming and saying, I just want to lose weight. And we say, well, that's an outcome. But you can't just wake up in the morning and say, hey,
Right.
I'm going to lose weight today. So you have to have some behaviors that go into that. So we help work with our clients to say, okay, what is the outcome that you're looking for? And then what are the behaviors that you need to do in order to get to that place where you can lose weight? And we always just have them we break it down far enough so that it's doable for them. So I'm not just having this blanket statement of eat better, exercise more, stress less. It's more of they walk away saying, okay, this week I am going to read the labels on my soup cans. I'm going to, just do one small step. I might buy a pair of sneakers so that I can go on a walk. So we try to help people break it down. A lot of times lifestyle changes aren't rocket science. It's just little things that we probably know that we need to do and just need a little bit of support in trying to figure that out. Yeah.
And so this wheel, I think it speaks to what you're talking about, and it isn't just one piece. It's really the whole person that I have heard. Hence, why it's called integrative health and wellness coaching. Really looking at what's influencing them, their life, motivations, desired outcomes. Really taking a look at the whole person. Can you share with us more about this approach?
Yeah, exactly. So when people often think of, I need to have a healthier lifestyle, they say those basic things. I need to eat better, I need to exercise. But there's so many other pieces that go into being healthy and taking care of ourselves. So there's a lot of different wheels out there. These wheels of health are really a self-assessment tool. It's a way for us to reflect on our life. Because a lot of times when someone's trying to lose weight or do something along those lines, what ends up happening as we talk to them and they go through this whole wheel, they're saying, wow, my relationships are really stressful right now. My work-life balance is way out of whack. And so what happens is I come home and I stress eat. And so we can't work on the eating part of things until we start to recognize what the root causes are for the behaviors that we're doing. So this wheel really helps someone kind of take a look at their life and think about all the pieces that are playing into it so that we can help someone break down those root causes. So we do call ourselves integrative health coaches, and I always thought it was interesting because we're not becoming an expert in any of these fields. We're not becoming nutritionists. We're not becoming a dietitian in any way, but yet we're becoming aware of all of these aspects. In our immersion weekends, this is one of the pictures from on one of the cooking classes that our students take during our immersion weekend. They've all gone virtual, but it's been just as exciting to cook in our own home. I actually just had some chili that we made from our immersion weekend a few weeks ago. I kept the recipe, and the students are really enjoying kind of getting this hands-on experience of all the different aspects of the wheel. So the nutrition is a big piece on that. Also mindfulness, we do a lot of practices with that. We do a lot of practices with just becoming exposed to all the different ways that we can take care of ourselves.
And there's so many pieces, and I know that I hope one of you will also talk about that active listening and that work that is so taught for our health and our integrative health and wellness coaches as to how to draw motivational listening or active listening. And I know that you've mentioned is to draw that information out so that we can help the clients and be successful. And so I think that's such an important piece that you have described as well. So we'll come back, I think, to more pieces of health coaching and where it can go and the types of opportunities. But let's take it back to UVM's program. What are we teaching here as well, and how do you get there?
That's a great question as well. And we have a few different ways that you can go about the program. We offer a 15 credit continuing education certificate that you can get that does not only our base coaching program that allows you to sit for the national board exam, but has a bunch of electives that help create a really well-rounded experience. So our curriculum is about 2 semesters long. And for the base of that, so that first semester you're taking 4 credits. We start with an immersion weekend, and as much as possible we're trying to have that in person. We just had one in person in September, 2 days here on campus, filled with a lot of integrative modalities and getting to know your cohort. What's really unique about this program is that we become a cohort of people who get to know each other really well. They support each other. They are sharing stories about their lives because we're coaching each other. We're coaching and we're being coached. So really important for us to create a strong foundation of community and a safe space for us to be able to practice our skills. So we start with an immersion weekend, and then every week we have virtual Zoom labs where we study both motivational interviewing and our coaching skills. So these labs are highly interactive. We have a little bit of a lecture component, but most of it is practice time. You're in breakout rooms with 3 students. You are practicing your coaching. We have mentors from the cohort ahead of you or 2 cohorts ahead of you coming back, listening, giving feedback on those skills that you're working on. And then we all come back together after our practice time and debrief it together and learn and grow from that. It's a really fun way to go about your experiences. And those classes are in the evening. So first semester, we have Monday evening classes. The second semester is Wednesday evening classes. And second semester is the same way, except we bookend. So the immersion weekend is the end of that semester. And we all come together for one final weekend and another weekend of wellness, as well as doing your final practical exam. And in your final practical exam, what's really cool about our program as well is that we have access to the simulation lab that the medical students and PT students and all the other students are able to use. So we have simulated patients that come in, and our students actually are doing that this evening for their second semester. They're practicing tonight in the simulation lab with some simulated patients, coaching them on an issue and getting feedback one-on-one during those times. So that is how we kind of move through the semester. Those 2 semesters are the basis. You just need to take those 2 semesters and you can sit for the national board exam. And then we have a bunch of electives that come after that. Everything from some specialty tracks. If you want to work on autism or you want to work in family wellness, we have some classes on there. We also have classes that really help broaden your idea of integrative health, talk more about critical neuroscience, and we have some really great roles on mentoring and the TA role. So you can come back and coach the students below. And every student that I've talked to that's gone through that has said, wow, I learned so much from helping other people learn the skills. So they go through the program basically again and give feedback to the students. So it's a really great opportunity as well.
And I have the good fortune of being able to talk to students that have gone through this program, and really it couldn't be more positive, the experience that students have had. And I think it's important that you mentioned some of the timing of those classes, because it is often people that are currently working in trying to juggle professional development at the same time as their current roles. And so I think Janet was a case of that. And she was a little nervous, I think, coming back to education and working as an adult and a working professional. But just seems the results have been so incredible. And another comment there from Valerie as well. And we have some of these stories on our website as well at learn.uvm.edu in the blog. So you can also go a little deeper into some of these student stories as well. So one of the things too is the experience that our students need to get to be able to complete the program and sit for exam. And this network, Cara, please tell us about this, because this has just grown and is an amazing opportunity for community to come in and connect with people and for our students to get experience.
Yeah, so we have this Integrative Practitioner Network, which is really a great resource for folks to know about anyway. It's a place you can find an integrative practitioner that's been vetted in the state of Vermont and actually our whole health network kind of catchment area, so upstate New York as well. But we use it as a place to connect with our trainees. So like Susan said, they kind of finish the core of the program with their practical exam. They are ready to get out into the community and start coaching. In order to sit for the national board exam, our trainees have to get 50 practice sessions. And so this is a way to find our trainees. They're offering free coaching sessions. And they can tell a little bit about themselves through this network, and it's just a way to connect with them. So all of our trainees, it's an assignment that they need to put their profile on the network as a way to kind of connect with the community. And we have a lot of community interest. You know, there's interest both on the UVM campus, at the UVM Medical Center, and in the community, the greater community, as far as connecting with our coaches. And it's been a really, really rich experience for our coaches. We also, I just wanted to add, have a health coaching collaborative in the state. And so we have nationally board certified or eligible. We don't exclude people as long as they're eligible to sit for the national exam. We meet monthly and kind of just talk about best practices, share ideas. We talk a lot about insurance coverage, liability insurance, you know, things that coaches are facing. And so all of our our students who are at that stage are welcome and do join us. So it's been a really fun experience to be able to bring them back and join us as they're kind of going along in their career.
Yeah.
So do you want me to address this next slide? So it's exploding and changing. It's been really, really exciting. And like I mentioned in the beginning, and I just want to reiterate, you know, there are these new CPT codes for coaches, which is super exciting. CPT codes are used to bill insurance. Healthcare providers need to have a CPT code in order to put into the electronic medical record so that they can get reimbursed for their services. The state of Vermont is really moving away, like I said earlier, from fee for service. So we are being incentivized to keep our folks healthy, and that is called value-based care. And so right now we're really looking at innovative models to bring coaches into the medical model to help with this kind of keeping our population healthy. But currently, you know, coaches work both in employee wellness settings, in hospital settings, fitness centers. Here at the UVM Medical Center, we have coaches working in chronic pain, orthopedics, in obstetrics, in child psych. So we have a variety of different settings that coaches can work in.
Yeah, and I know you mentioned several of those here too, and just the statistics in terms of, and there's lots of articles that have been written about this. I think we've seen many major news organizations say, what is this and why should you know, and the growth that's happening out there too. So I think just seeing a quick list of employment opportunities, this is a short list. I suspect the list is quite broad if you really start digging out there and seeing the career opportunities.
Yeah, it's definitely growing, and we hope to really, grow further in our state right here. I think we have a lot of great opportunity. And I think this next slide is prompting me. One of the things that we're doing is we realize that, we have opportunity right here in our own backyard to work with folks, employees, both at the university and the hospital. So we rolled out a program called Open Source Wellness. Our health coaching faculty are the lead coaches in this program. We meet with folks once a week on Zoom, and it's really a lifestyle coaching program where we're talking about so many of those things that Susan was talking about earlier in this webinar, really like what matters to you, what is going to inspire you to make those healthy choices. And it's a support system. So we've joined together in a large group, and then we have small breakout groups. Each of the coaches in our small breakout groups have a student coach that's kind of more advanced in their training, and they work with us. They do a little coaching. They also do this really awesome piece, which is they connect with our small groups throughout the week. So our students are getting this real rich experience. We use an app called GroupMe, and there's these great conversations that happen midweek, kind of checking in on people's goals, and the group really inspires each other to make those healthy choices. And we all have setbacks, and we're not perfect, and then we kind of pick up and start again. So it's been a really fun experience.
So
for all
what
of
I
us.
keep just hearing and just seeing how much this program has grown is the opportunities for our students to get experience just keeps getting bigger and bigger and bigger. Yeah, which is so amazing. Which is so amazing.
Yes, absolutely. That's our goal. That's for sure our goal.
And so the pain center, you mentioned that as an opportunity for coaches. So just give us a little bit of an overview of how this fits in as well.
Sure. So, UVM Integrative Health, we have clinical programs, we have education programs. Obviously today we're focusing on our health coaching certificate, but I actually do the coaching at our comprehensive pain program. It's a really innovative clinic. It's on Tilly Drive. We opened in 2018. And I think the thing that I really wanted to share about this is the uniqueness of it is that it's a bundled service. So for our Blue Cross Blue Shield patients, and they're spending 13 weeks with us, and part of what they get is some health coaching services as well, in addition to many other integrative therapies, including acupuncture, yoga, massage. We have a teaching kitchen, and we offer culinary medicine, PT, OT. It runs the gamut. That could be a whole other webinar. But, what I wanted to share about this is it's a really good example of value-based care. We have added a coach into the service as part of the bundled service. We have had students also do their practice sessions at the clinic, which has been a really, really rich experience for them as well. So we hope to have more of these relationships with other clinics across the UVM Medical Center and Health Network.
Sounds such an important work. And we were talking before we kicked off the info session today about this slide, and my goodness, the connections that this program has grown over the last couple of years. It's amazing. So what does this slide mean to our prospective students?
Oh my goodness. So, what I wanted to share is that we are working hard towards equity, health equity. Really, that's the piece that I'm super passionate about, is how do we deliver these services for everybody? So we're working on lots and lots of different initiatives, like the comprehensive pain program, on making sure that we're rolling out programs that give access to everybody, that it is not healthcare for the rich, that this is healthcare for all. And so these are just some of the national and state and local organizations that we have relationships with, that we're working on projects, doing research with. And so I just wanted to give a sense of the breadth and and all these different amazing organizations that we're working with to try to move healthcare so that we can really offer this value-based care approach.
Absolutely, and it's working. So thank you for all of the work that you've done. Thank you, Cara. And I know we have some questions. We'll come back to those questions in just a moment because we may be able to answer some of those in these next couple of slides. Susan, walk us back through. So we've heard about the why and what this is, and the program and the amazing outcomes and opportunities for health coaches. So let's go a little deeper into how do you get into the program?
Yeah, it's pretty simple. If you go online, find the website. There are education advisors that are willing to walk you through all of these. I thought a lot of questions kind of about payment plans and those options right there. I know that UVM is offering a tuition in terms of out-of-state tuition is expensive at UVM, but what they're offering is that you get in-state tuition even if you're out of state for the health coaching program. So you can go online, chat with someone. There is a very short application, and we start our next cohort number 5 will be starting in January. So we're already accepting applications for the January start. And what's really unique about our program as well that I wanted to touch base on is you mentioned that this is for undergraduates as well. So we have a mix of students in our cohort that's coming up. So we have some undergrad students and we have some continuing ed students. And both sides have remarked on how interesting it is to connect with someone of a different age group and to be able to coach not just your peers, but everyone out there. Our 20-year-old saying, wow, I've never coached a 50-year-old before or talked to someone that much. Or a 50-year-old saying, how do I, we've had conversations. How do you connect with a 20-year-old when you don't know pop culture? You don't know all these things. And really what you were saying, it's all about active listening. It's all about really hearing what someone's saying. And I think what's really the biggest takeaway from most of the students that have gone through the program is that it has changed the way they have communicated. Not just in their work or in their job, but in their life. They're saying, wow, I never realized I wasn't hearing what people were saying. My relationships have gotten better, my communication skills, people talking to their parents for the first time in a long time and really helping them understand what communication is and the skills of having a conversation where you're not just thinking of your own response to the story, but really listening and hearing what someone else is saying. Such a
wonderful outcome and probably unexpected for people as they go into the program. And so thank you so much for sharing all of this amazing information. We do have a couple questions. And Taylor, yes, this PowerPoint can be shared, and we will share a recording of this entire presentation. So you're more than welcome to review that as well. And payment plans and different financial options, that would be something probably, Devin, that would be great to talk one-on-one with one of our enrollment coaches. Just trying to understand a little bit more details there to provide you the best responses and information. And Alicia asked a great question too, the cost of the program per credit or the program as a whole. And it really depends on which way you're going. Is it for credit, right? If you're looking for the credit side, there's a per credit hour. And as Susan was mentioning, there is the Vermont state, the in-state tuition credit hour offering here for out-of-state folks as well. And then if you're going for the certificate and non-credit, there's a different price there too. So, and again, that information's on our website. And Kelly, if you could, Kelly on our team, if you could pop the link in. And again, these are wonderful questions that our enrollment coaches absolutely will chat with you and would love to share more information to help you. This one's a great question also from Devin. Do you know of any integrative health coaching connections that are located in New Jersey? And maybe while you don't know, or maybe you do, something specific in New Jersey, I think it kind of goes to the question, how do your students find opportunities outside of Vermont? How do you build that network for them or help them build it?
Yeah, I can answer that question. So Devin, I do know folks in New Jersey. It depends on where. It's a big state. So maybe shoot me an email and I can chat with you about that. But, I'd like to share that we're part of the Academic Consortium for Integrative Medicine and Health, which is a really great organization that has an integrative program either at a university or a teaching hospital. And there's, I think, 75 to 80 different programs that are part of this consortium. We're really active in it. And that's always a great place to start. That's kind of where I tell people to start. And then once you are a board certified health coach, you will be part of the database that the National Board for Health and Wellness Coaching puts out. So there's a lot of connections that can happen through that organization as well.
Great. Wonderful. Thank you for asking that question, and very good information for people to know that there's a lot of networking and connection opportunities. I'm not sure who, maybe Susan, maybe you want to take this one from Amy. How many hours per week should be dedicated to the classwork?
It's a great question because you're taking basically 4-credit class. The immersion weekend is one of those credits. So basically the amount of work in a 3-credit class, which means there's a 3-hour class every week for the length of the semester. So the 3-hour class, and on top of that, you can expect probably somewhere between 5 to 8 hours of work outside of that for the rest of the week to be working.
Okay. And when they start doing the training and the 50 coaching sessions, how long of a time frame do they have to complete that? It probably just depends on when they want to sit for the exam, I would imagine.
Exactly. I played that out for our students who are graduating at the end of the semester. Our students who graduate in December they have a short time frame. They have about 8 weeks to get all of their sessions in before they could sit for the May exam. A lot of the students are choosing to wait until the fall exam the next year, in which case they have about 7 or 8 months in order to collect those sessions. So it for both either a spring graduation or a winter graduation, there is either a short time frame, and we're really working with all of those students hard to make sure that they can get those 50 sessions in that short period of time, or a little bit longer.
Yeah, great. And thank you for sharing, because I didn't ask, but I should have. When can you sit for the exam? So it sounds like you can do that 2 times a year. So that's super helpful too. So if there are any additional questions, please do ask them. We're going to try to wrap up here in a few minutes. And again, lots more information on our website. And I know our wonderful Kelly, who's behind the scenes, will put a link up to the program page as well. But Cara, tell us about this picture. And I know it was several years ago because everybody's arm in arm and no mask, but tell us what's so significant about this.
Yes, I know. It was pretty cozy with Bernie there. So the woman in the gray suit is Tracy Gaudet. Tracy's a real leader in the health coaching field. She started the whole health program at the VA. She now is the director of an institute that's promoting whole health in the civilian world. She's kind of just this person that we look to for teaching and learning. And she came to do a Laura Mann lecture. And actually, Bernie recommended her because he is very much a big fan both of integrative medicine and the VA. And so we asked Bernie to introduce her. So it was right after he put his name in the ring the first time around to be president. And so Secret Service were there. It's kind of a fun, exciting day. But she is a very, very much a leader. And her presentation is still on our website if people are interested. And I will put our website in as well.
Thank you. And I know we had a question here too from Alicia. Is how quickly does it fill and once registration opens? And it tends to fill pretty quickly from my experience. And so if it is something that you are interested in, I would highly recommend jumping in there and putting in your application. Do you have any other feedback on that, Cara, as well?
Well, we are. So go ahead, Susan. Go for it.
I was just going to say our cohorts are small. We have only 30 students in each cohort. And half of those are usually undergraduates. So we do have just a smaller place for the continuing education students, although our January start is larger for our continuing education students. So this spring start is the one that is more likely to be available as well.
Yeah, I was just going to say that we will have a bigger portion of CDE students in the spring.
Right.
So, which will be our first time sort of having it the other way. Like we usually have had more undergrads and less CDE students.
And so really, yeah. And so just thinking about, those kind of 2 times a year, to get in, to start the program and to get into the program as well, I think is great when you're looking at what you're planning as well. So, and I see we've had a couple other questions, but it looks like Cara and Susan have jumped in and answered those questions. And I do see Maggie's typing. I don't know if you have a second to see what the question that we might be. Oh, there she goes. Oh, good. Thank you, Maggie. Registration opens on November 29th. You may want to apply and commit and register promptly. Yes, it does fill it. And as both Cara and Susan have mentioned, it's incredibly popular, which is a wonderful thing to think about, that value-based education, and that more and more employers and healthcare providers are really looking for health coaches. So it definitely is growing, and we're so thankful for that. So I think we've gotten everybody's questions. Okay, this sounds great. So if there's anything else that we could answer, please jump onto our website at learn.uvm.edu. There are enrollment coaches that you can chat with. So oftentimes you can get that instant question answered through chat. You can also find lots of information on the program page about integrative health and wellness coaching. And as Maggie shared, that the registration opens up soon for spring, and we really hope that that we see everyone in our webinar here continuing their education and considering our integrative health and wellness coaching program. So we wish all of you good health, and we wish you a wonderful afternoon. Thank you so much, Cara and Susan. Take care.
Thank you.